mindset, the energy and the information. They're changing once you understand that you're going to be okay and you dissolve your problems. Okay? Sometimes people need to dissolve what created it. So today somebody stepped into my clinic, today, where one of her relatives, very close relative, got in trouble immediately. Something very big happened to that person. She got in pain and sick and crying. She came. How long it took for her to develop that? 1 second. She got a phone call. The phone call was a bad phone call for her. She was here today. She couldn't bear it. So it took a second also to reactivate her and tell her, listen, it's not permanent. It's very short-lived. Don't worry about it. She said, I know. Okay, thank you. And she got out, walking okay, and she was less stiff, more loose, and smiling. When she came in, she was almost crying all the time.
But how does pain come into this then? Because what if your mind changes, but you're still in pain, and then it keeps putting you back?
Okay, pain is a tool within your body for certain things, not for everything. So if you have fear, that will be a different type of pain. Fear, anxiety. But if you'll be sitting on a nail, the pain needs to warn you immediately that you should move out of there. If you will have a slow developing pain in your tooth, it will warn you because it will come first just from cold water. If you don't understand it, it will come from warm water. If you don't understand it, it will come little bit by little bit more permanent, right? Then you know, okay, so I'm going to the doctor, he's going to drill, close it in. So pain has that immediate warning or slow developing warning, and then chronic warning. Okay? So what people doing with pain, usually when they have pain, what are they doing? They're taking painkillers. Is it right? Okay, so you take a painkiller, you're treating the problem? No. So the pain will persist a little bit more and more and more because your disease will grow, or your inflammation will be worse and worse and worse, but you subsiding the pain, it's not going to work short term.
But my question is, how you want us to keep a positive state of mind? How do you do that?
I don't want positive. I want constructive. Big difference.
How do you do that when you're in pain?
Okay? You ask yourself, what is the pain telling you?
That something's wrong.
Yes, what? And how I deal with that, what I do with that. Is it in my control, is it not? If it's not in my control, I'm not worried, I'm dealing with it a different way. If it's my control, I'm dealing it in a different way. But I understand that I have the privilege to have pain to let me know what I'm doing with that, what I'm doing in my life, where I'm shifting myself. Is it a physical shift? Is it a mental shift? Is it a biochemical shift? Is it all together? On and on. Okay. Okay. How long it takes us to be healthy? Longer. So then the healing is fast, but the health of the tissues can take a long time, but it will happen. So that's why when I say it will be okay, so you build that for that. Okay, next. So pain is, again, it's warning. We understand that, right? All of us? If somebody doesn't understand, I have a hammer, it can come close to me, and then you go away from me. Next. Warning signs, pain, disease, illness. Only. Warning signs. Okay, so sickness, pain, fear, and others, are they blessing or curses? Blessings. It's okay. It's blessings. Or a curse. Curse. We got a curse there. It's a curse. Okay, why?
Why do you want to be sick?
Very good. So let's say that that you have severe blood pressure condition, but you don't have a headache or symptoms at all. And then one day you'll get a heart attack on the spot or brain aneurysm. And then you go in a second, but because you didn't have the warning of the pain. So again, it's just a warning. So a pain or disease is only signals. So if you didn't have them, something will happen to you and you will miss out. Next. So this girl, her name is Pascal Berkovich. She gave me that pictures right there. She came to me, she is Paralympic for Olympics. The only one in the world that are participating in 4 Olympics in different sections, different type of sports. So I work with her through London till now, all the Olympics till now, and now we're working in Tokyo. But if it will be, I don't know. And she, when she was 16 years old, she went to the metro or the train in Paris, and near Paris somewhere. She slipped because it was icy, and the train ran over both her legs from here. And she was a dancer. And she was laying on the tracks for 40 minutes because nobody was there. It was 6 o'clock in the morning, and more trains coming. So she made that curse to a big blessing. She have 2 kids, beautiful kids. She have a husband. She has strong head. She's lecturing all over Israel and before also out. She's doing great. And a lot of people, she's a model for a lot of people to follow because she made the curse into blessing. Exactly. So why we touch? Why we, when you're laying down, we're creating contact on your body? Because we're activating biological energy with biological energy. We're activating it in different depth, in different areas, different time, different lengths. We're doing a lot of things with it. And you need to understand something very important. We as a human being working between brain waves and hormones. Our brain waves have parallel hormonal behavior. So when they are both working in synchronization in the correct form, we're healthy. So when I create contact in your body, it resets your body and restarts your body and resets your brain waves and your brain energy compartment synchronization with your body, hormones, nervous system, tissues. And then that's how you restore health. You reset the system, you restart the system, and you upgrade the system. That's what we're doing when we're doing body contacts on you, very precise ones. And when we do that, as you see that we're changing the brainwaves. That changed the hormonal system. Then the hormonal system changed the emotional and immune system. That changed our physicality, physical forms. And then body, mind, and then back again to the brain, and it's a cycle that we activate, and you later, you retain that. And your body's continuing doing it more and more and more as more we do that. So here, we're dealing with this vehicle here, F-15, is costing like $100 million. And you need to fix the wings, the wheels, steering gears, everything. But if you're not dealing with the 2 pilots there, this whole machine is worthless. Here we're dealing with your inner pilot, brain, nervous system, okay? Emotion. Now, very important point. That's where the healing and restoration of our body and mind coming into play. Which means, when somebody comes here and he has a minor neck pain, formed 3 days ago. So when he comes here, it comes at 0 at the water level, just to restore him back a little bit above the water so he feels okay with himself. But as deeper his disease, injury, or illness goes, when he comes here, he is lower under, he's situated lower under the water in minus health, Therefore, when patients come to me, I look as to what is the depth of their illness, sickness, pain, mental state, emotional state, how long they carry it, how deep is it. That's how we can determine what to do with them, which of the 5 medicines to put in for them and how long it will take. And some are deeper than others. So that's how I constructed. Okay? Remote treatment. As we know, and quantum mechanics tells us that everything are fields of energy, atoms that creating fields of energy. So the space between us is not empty. We are fully connected at all times, at all given times. And the distance doesn't matter. So we can activate people from here, or wherever I am, to wherever they are for treatment. And we're doing that. And I develop it more and more and more. So Dr. Plotkin is here, is a guest for us. Do you familiar a little bit with AK? Oh, applied kinesiology, you're using it? Sometimes. So if you understand that, so I want to show you something. Is it okay with you guys? Lights, please. Yes. Can I have you for a second? Yes. So, so if we want to affect this guy, let's say now, power of force, okay? So are you right or left-handed? Right-handed. Okay. Put your right arm up, and you can open that thing. This is only a demonstration, okay? It's nothing but demonstration. So when I push hard, resist, okay? Resist hard. So you have good resistance. You feel that? Okay. Now I can hang on you and put your hand down. That's not the point. The point is if you have enough resistance, okay? So he has good resistance now. I'm going to go to the other room and cancel it, make it less resistant. Yes. Okay? And then I'll fix it. Okay, I'll be right back. Now, there is always a question. You put more force or less force? No. I put the same force. You become stronger or weaker. I'll go to that room, come back, and you'll see that will be weaker. Ready? Okay. Put your arm. Resist as hard as you can.
Oh, come on.
Yes. I can do it on you if you want to. Okay? No. It's not the strength. It's what happened to his nervous system. I'm going to fix it for you now. Okay? It's fixed. So resist now. Okay? Okay? You felt that? That's good. So it doesn't matter the Thank you. Thank you very much. Thank you. So it doesn't matter the distance. It's what you're doing with that frequentization, energy. What you're doing with that. You can affect anybody from a distance. It doesn't matter what he has to. You need to prepare for that, and we asking permission and time, and it's involving a lot of things. So, but that's because we are 99.9999 energy. Very little material that is formed as a material, so we can experience this world. That's the only reason. Okay. Next. Yeah, they'll put the lights on. Okay. That's it. Thank you. So this was it. And if anybody has any questions, I'll be happy to answer. Please.
I feel like I'm the geek of the class.
No. No. That just shows intelligence. I don't want to tell you what it tells on others.
I know.
Just kidding.
So when you're touching us, are you sending signals to the brain and nervous system or to the organ itself?
Okay. So when you're touching, it's neither. Okay? When you touch the body, you touch actually a field. If the field is not synchronized, not in its correct vibrational energy, and I don't need to know yours. It's like, I'll give you an example, okay? You're coming with your Jeep and your battery is low. Somebody comes with another Jeep and he puts his cables to your battery. and give it a jump. That's it, one-time shot, right? It activates your Jeep back to life, okay? With human being, it's the same, but almost the same. So when your systems are going out of whack, out of synchronization, because of a reason, you reactivate him. You reset him and reactivate him to it. And you enhance it more and more and more. Because two things. One, you might have damages that will need more and more and more pushing them to be in their correct forms. For example, I'll give you an example. We had a kid here. She been in severe pain, 8-year-old, severe pain for 2 to 3 weeks. She'd been to Hadassah in Karem. Her father told us that she was examined by 8 professors. Some of them special child professor, child doctors, pediatricians for that, pediatricians for that, pediatricians for that. 1 month, I think. She came here with MRIs, with all the exams. And she didn't sleep. She was in constant pain. She was on Optelgine for adults doses because it won't go away. And she was crying all the time. She wouldn't eat. She would, nothing. And I frequentized her, first time, frequentized her. She fell asleep. And the father, he was worried. She didn't sleep for about 3 weeks or a month. And she was on high doses of Telgin and Acamol. She fell asleep. Now and I told them, everybody went home. And I left her for another half an hour to an hour to sleep. That was the first sleep in a very long time. We did only frequentize her. All we did. And when we woke her up, she didn't want to wake up. She said, no. And she came in, she slept on the chair here. And then she went to sleep on the chair. So he did all that every day, and she wouldn't go home. She felt so good. Now she's after the 4th treatment, or 3rd. She's no pain. She's back to school. She's eating. She's doing everything in very short time. So, no, thank you. That's not the idea. The idea is when you put on back their correct frequentization, their body is doing everything. I'm doing nothing with you. Just activate you to activate yourself. Self-healing, everything is you self-heal. Everything. You self-sick and you self-heal. Unless you're getting injured from the outside. That's another story, by the way. But that's a different story. Also, we are there too for that. For injuries. Like they say car accidents, I had an accident, nothing is an accident. But that's a different day. So I'll take his question, then you.
Does age have much to do with it? She's young.
Yeah.
When you're older, does it react the same?
Yes. So age have to do with what I showed you with the mountain under the water, with the glacier under the water. Age might take you with your system lower below. So it will take a little bit longer time to bring you up. Another thing, she had it for a month, what she had. And somebody else can have it for 20 years, 15 years, 30 years. I have somebody here with 30 years. And they say, how come after a week I'm not okay? I said, let's talk about a year. Okay, and then a year would be okay, for example. Yes, please.
I just want to ask you, we come to your clinic, and I told him my knee, my heart is pain. But I have a lot of things.
Yeah.
Do you know that I have more things, more sickness in my body, or I have to tell you?
First of all,
I have sugar, or like I have
okay.
headache, or
It's very good to tell me, because when we look at you, we want to go and see all the signs that you have. So to know that we probably need, as more signs you have, we'll have to deal with you for more aspects of ultimate medicine. Okay? So with this child, for example, we're dealing right now with 2 aspects only. And with you, we might have to deal with 4 aspects or 5 aspects. Yes, it's very important. That's why we're taking extensive history. And then, but yes, you need to let me know. And then we need to work with a deeper and deeper We're going to sit, for example, with him longer for certain things, on and on and on. Yes, it's very important. Anybody else?
And when you give us frequency, is it affects you?
Very good question. Yes. How? You see, she asked a very good question before. I'll touch him, what will happen? So when you're going to the lifting room first day, a gym, and you're going to be in the gym after 2 years, you'll know who's been in the gym for 2 years and who's in the gym first day, right? So you exercise your mind and your body more and more and more, and with a very powerful way, that as what you give, you also have. So you build yourself more and more and more, mentally, physically, biochemically. You're becoming sharper, your mind, your body. When you do that, you're thinking. So I need to be an example for you. And when I give you what you need, if I'll be very sick or ill, it will be, I can still do it. It's not the best example because I don't have it to give you. It's not giving you a pill. It's giving you energy, information, vibration. It's different than giving you a pill or prescription. Very big difference. Now, for example, you don't want your surgeon to be ill or sick with foggy brain and shaky hands. True. You want your surgeon to be in great shape, happy, confident, sturdy hands, clear mind when he's operating on you. If you see him, or your pilot, by the way.
Can you heal yourself?
I'm sorry?
Can you heal yourself?
Yes. Yes?
No, I mean you.
Yes. Absolutely yes. We are our self-healers, first. Second, sometimes I need a jerk out from somebody else. And I need to know when, and I do that. It's less and less, but sometimes yes. Okay? Because I need to know when I need a hand from the outside to put me in level to keep doing what I'm doing correctly. But I know when I'm going to be sick, and I prevent it. I know when I'm going to be injured, and I mostly prevent it. Mostly because I get carried away, I want more. Mostly I prevent it, mostly, not all the time. But then put it back to myself. So try to stay in line with my vibrational frequency. First, for my mind. First of all. Then accurate food, then accurate behavior, on and on and on. Thank you very much. Unless somebody have a question. Okay, we'll deal with you. No worries. Thank you very much, everybody. Thank you.